Good morning. I'm so happy to be at this point in the day. You have such an amazing number of choices for learning and reflecting on youth development. And knowledge is power, Francis Bacon said. And Thomas Jefferson expanded on this to say, knowledge is power, knowledge is safety, knowledge is happiness. Imagine that. How do we get from we think to we know? We observe in the field that young people communicate better after being involved in a program. They report using condoms and having safe sex. And we say, I know that those young people are better off because of the program. Is that knowledge? I had the pleasure this year of working with a great group of colleagues to investigate how some youth programs integrate workforce development and sexual and reproductive health programs, which I'll just say SRH in the future because it takes too long to say the whole thing, to improve the lives of youth. What are the features of integrated workforce and SRH programs that generate the most impact for youth? Do we know? The assessment of workforce development and sexual and reproductive health programs answers these questions with existing evidence and describes gaps in both programming and research. We conducted an extensive literature review with input from a consultative group of implementers, funders, and researchers, some of whom are here, and identified 48 integrated workforce and SRH programs, 17 of which had impact evaluations. We then developed and tested a coding scheme with input from the consultative group. We coded the project's features in an inventory, which then served as the team's database. The inventory will supplement this report, making the data open. From the data, we created a snapshot of the field as we know it today. We can see what features are frequently integrated across the sectors and where there are apparent gaps, such as the lack of interventions in workforce that use value chains combined with SRH. And value chains, as we know, are seen as a very promising development approach. And as Marty said, we see a lack of LGBTQ in the populations. From the data, we mapped the projects with and without impact evaluations, and we can see where there are research gaps. So if you can imagine a social network map, so for those of you who are familiar with them, we map them out using this kind of feature, and we can see that most programs, if I could do it with my hands, most programs are in fact overlapping. There's integrated programs with impact evaluations and integrated programs without. But my thumb over here is one group of projects which don't currently have any evidence about them, but studies are underway. And those are workplace programs with reproductive health. So going deeper into the evidence base, we discover which project features in combination yield the greatest positive outcomes for youth. Oh, sorry, I hit the wrong button. Technical vocational skills, fortunately I only have 2 slides. I don't have to touch anything anymore. So they are things that we're hearing about, right? They're technical vocational skills, workforce and SRH soft skills, information about HIV, pregnancy prevention, and puberty. Knowledge and skill building are implemented through workforce and SRH curricula with support of mentors. Support to help youth return to school or find work was also common, though not found in all the top scoring programs. Yet the most effective programs are more comprehensive than integrated workforce and SRH. They include nutrition education and literacy training. They provide opportunities for youth to interact with each other and with adult and peer mentors through play, such as role-playing in sports, accessing books and learning resources in safe spaces where youth may share experience and learning, thereby reinforcing positive behavior. For example, Balika's incorporation of role-play and learning resources made the workforce and SRH life skills curriculum more interactive and engaging. The most effective programs address the enabling environment by engaging families, community members, and key stakeholders through social and behavioral change communication to shift norms and create a supportive environment in which youth can flourish. I can't give another example because I'm out of time. These findings, though, as you've heard from those who've presented the Positive Youth Development Framework, they are consistent with this broader literature. They highlight the importance of social capital and positive relationships, enabling environment, including parents, adults, and community, and by providing youth with holistic services that address a broad set of needs. And unlike our folks who were debating last night, we have good ideas about how we go from we think to we know. As Marie said, we use science. Knowledge is only as powerful and provides safety and happiness when it is used and used well. So we'll discuss the theory of change, findings, and process based on your expressed interests at table 13. Thank you.